All right, go ahead, head first. Hey, how's it going, guys?
Hi. Good.
So, we got a 55-year-old male here. He presented unconscious. He was found outside. We brought him inside the ambulance. We got an IV started. We gave him normal saline, and we gave him 2 milligrams of Narcan. He came around. He's got a steady pulse of around 80. We got 2 sets of blood pressures. Where'd your blood pressures at, Marilyn?
I just handed you the card. It's got one on the corner Bible and one.
We got one at 158/70 and then 110/76. He seemed to stabilize. Said he had surgery yesterday and he took his morphine. So he may have had a morphine overdose and went into some respiratory distress. Let's get that off. Here's wife. How you doing, ma'am?
I'm okay. What? I got hit in his hood.
So we heard that he had surgery yesterday?
He had his gallbladder taken out.
Okay. Do you know if he's taking his medicine too much or maybe got confused and took it too often or anything?
He's just been taking it for what the bottle said.
Okay. You guys ready?
There's a tube right there that's small. Don't let that pull on him, please.
1, 2, 3.
Oh.
All right.
That hurt him?
No, he's okay. We took care of him.
Is he okay, honey?
He may just have had a reaction to the morphine.
Do you know if he has any allergies?
No, he's just been completely healthy. He has some gallstones. Is this going to hurt his leg?
No, we'll get that removed off of him. Let's get the,
Put it right here.
Anything else you guys need to know? You want to put him on your monitor?
Yeah.
Alright.
He ain't breathing no more.
He stopped breathing. Let's push another 2 milligrams of Narcan.
We left it.
2 milligrams of Narcan?
Yeah. He still has a pulse. Let's put him back on a non-rebreather. Yeah. Can we bring a non-rebreather? Let's get some respiratory therapists in here. Can you guys call respiratory therapists?
Do I need to give you some more help? I'll call them.
We need to. I need this. He's not breathing.
I need respiratory therapy.
Does he have a pulse?
Yes, he has a pulse.
What's going on?
He's gone back into some respiratory distress, ma'am. He may be having a reaction to the morphine.
Distress? What do you mean distress?
He's having trouble breathing.
But he just had his gallbladder taken out.
The medicine, the morphine, it can cause problems with breathing, so he may be having a reaction to the morphine.
We have a 55-year-old male.
He's got a carotid.
What? And he just stopped breathing. His latest blood pressure
Wake up!
was 76, pulse was 82, and they just gave him Narcan. I think he may have overdosed on morphine.
Overdosed? We just took it because of what was prescribed.
Are you taking
He came back and started breathing. The first dose of Narcan, and then he just recently
Does he use
started.
98.
98%?
No, I'm talking about pulse. O2 stat.
Do we have that?
We have exposure to that now.
Yeah.
Okay.
I know we've done everything.
It was 140 right now.
What do you mean you want to know what his stats are? O2 saturation?
Yes.
I don't know.
Ma'am, is there somewhere we can call for you?
So easy.
Yeah, we
No, I just want to be right here.
How's his pulse? Let's get another pulse check.
His stats are 100%.
Okay. Would you say his blood pressure was? Yeah, blood pressure.
110/76 when they brought him in.
Let's get another blood pressure check.
We need to check that, and then we could.
Let's get another
dilator going on.
Yeah.
I'll go ahead.
So just bronchodilator.
Blood pressure.
I'm glad somebody let the attending physician know y'all got sick patients y'all are bagging in here. Is there something going on I need to know about, or can I get back
Please
to
help
dinner?
them. Something's
Ma'am, what's going on today?
I just found him on the couch and he was just really not talking to me or anything. And I called 911 and the paramedics came and packed him up, but they keep saying something about he overdosed on his medicine. He had his gallbladder taken out yesterday, and he's been doing fine. And I just found him like this, but they keep saying he overdosed, and we just did it per the prescription.
Was that Narcan ever given?
the second dose of Narcan.
Would somebody like to tell the doctor in the room what's going on? But if y'all got this down, that's fine. I'll be glad to go back doing what I was doing. I mean, I'll be glad to go to lunch.
The patient was found unresponsive, responded. He was out in the heat. We brought him back inside.
How long has this patient been in my emergency department?
He's been here
Just
about
arrived.
2 minutes.
He's been in here 2 minutes?
Yes, sir.
Okay, so what have we done for him?
So far, since we've been in here, we gave him another 2 milligrams of Narcan, and we've got him on the bag mount vest. He was breathing. He stopped breathing on his own again. He's got an O2 stat of 100%.
Is that with the bag valve mask, or is that when he's on non-rebreather?
That's with the bag valve mask.
Has he made any respiratory effort on his own?
Not since we're waiting on this second dose of Narcan.
Have we put any airway devices in, nasopharyngeal, oropharyngeal, chest and gag reflex?
No.
Okay, ladies and gentlemen, let's take care. Do we have circulation?
Yes, sir, we do.
All right, let's take care of airway first. Do we have a finger stick on him?
Yes, we do.
140.
Okay.
He coughed. Is that a good thing?
He's got bilateral wheezes also.
He's wheezing bilateral also?
Sure.
Okay, so which part do we want to take care of first?
We want to get that airway.
I've got to consider that airway first. All right, where'd y'all find him at, actually?
He was outside.
Hey, honey.
Okay.
Does he have the wheezes up top?
The upper area.
So we gave, how much Narcan's he gotten?
He's gotten 4 milligrams Narcan so far.
And is the monitor correct?
Monitor appears to be correct, yes.
John.
Okay, and you said he had surgery yesterday, gallbladder.
Hey, John, how you
He
doing?
was taking the Narcan. And
Can you hear me?
Excuse me, he's taking the morphine.
Yes.
Okay.
Yes.
All right.
Raise my hand if you can hear me.
He's talking, so let's stop, see if he's breathing on his own.
Yeah, he is
So
breathing
trying
on
to
his
help his
own.
All
respiratory
right,
effort.
let's put the non-breather back on.
What position we got this
All right,
patient
John, you're at
sitting
the
in?
hospital.
He's in
Your wife is right down here
What
by your
position would
seat.
y'all like to put
I
him
might
in?
hear the wheezing right now.
Would y'all like him
Raise
sitting
the
up a
head
bit?
of the bed. And,
I might hear the wheezing now.
Can you talk to me?
What's his respiratory rate?
Let's see what we got.
Is he going to be okay?
It appears his respiratory rate's 12 times per minute. That's adequate on a non-rebreather function, maintaining stats. Respiratory, you're to continue watching his airway. If his respiratory rate drops below 10, you're to notify me immediately. Don't sit around in here waiting. We want 12 lead, lab strong, chest film done, and just for giggles, go ahead and get an we'll get an ABG on this patient. Get that sent off. Do y'all have anything further you need to add before they pass them off?
I believe full report's been given.
Thank y'all. That's how a doctor will tear your tail up in a heartbeat.
I see
Turn the
that.
oxygen off.
I see that. And I've seen that before, actually. Not me, thank God. Yes, so,
Whoever answered the phone and took our dispatch should have had the ED doctor in here with us.
It's not dispatcher's responsibility to call and ask for a doctor.
We're reporting to the
So I'm assuming
That's
that's
a-
not probably
okay,
not-
yeah, request is respiratory drive.
They're on the fifth floor of the hospital. All they do is type in the computer and says EMS 10 minutes respiratory. That is the only report they get.
Who requests the doctor then?
Well, in this scenario, if you don't have one in the room, somebody needs to make sure they make a point, especially when they're that sick, that somebody says, we need to get the physician here or something or other. Because, I mean, if you're in a small hospital and y'all been in here, you've been in here longer than 2 minutes, by the way.
Oh, man.
You good try, though. They walk in, they're going to eat it alive because his simple problem was morphine overdose. Simple problem,
Diaphragm
Narcan.
was...
Y'all gave Narcan, he got better. Narcan wore off, he went down again. You gave him more Narcan, his respiratory effort picked up again. And that's one of the patients where you don't know how much he took.
Right.
Do you take one morphine tablet? Do you take 10 morphine tablets?
Right.
Is this going to be that patient you sit there every 20 minutes going, here's more Narcan, here's more Narcan, forget this mess, let's get Narcan drip. I mean, that's what type you're dealing with.
Mm-hmm.
And the other thing you got to worry about, if you got that narcotic overdose patient, you give Narcan.